My friend, welcome to this video. ERAS application is critical for your residency application. And in this video, you will learn all the tips you need to know for an outstanding ERAS application. My name is Dr. Farzana Hoque. I'm an associate professor of medicine and currently working as an educator as an acting internship co-director for over 5 years. I have experience as an IMG when I was candidate like you. I have learned from mentors. And now over the years, practicing in the physician in the US as an interviewer, I reviewed applications both from US medical graduates as well as international medical graduates. And I have seen that whatever the things they are doing well and what are the things you must avoid to make sure your residency application stands out. All the things will be included in this video. Let's get started. So why ERAS application is important for you? Because ERAS application is representing you because residency program doesn't know how wonderful you are. This is your responsibility to represent yourself, to tell them why they will call you over other 5,000 applicants. So this is the great opportunity to represent you. It is critical to get interviews. ERAS application is your first step to put your foot in the residency interview. After the residency interview, then you will go through match, right? So this is your first and very important step. So I always tell my students that either you use it to win it or lose it. It's truly your choice. However, I know that you want to win it, and that's why you are in this video today. So let's unpack which things you must need to know. I believe you have already started to work on your ERAS application that has been opened from September 3. Very important date here. September 24, the residency program will be opening and they will start reviewing ERAS application. So they will not review before that. My advice will be, take your time to write, proofread, revise your ERAS application and submit maybe 1 or 2 days before September 24. Do not submit very long ago because, you may find out that there is some mistake. And once you submit, you cannot change it. And after that, if it is after 24, programs get lot of applications. In our program, we get application around 5,000, 6,000. So many programs, they download their application on first day, which is September 24. So I will highly recommend not to submit after that. And hopefully this video will guide you that, okay, which things you need to do in a timely manner so that your application will stand out and also you are submitting in a timely manner before September 24. Disclosure, I'm not a professional resume writer. At the same time, over the last 1 year, I have reviewed, lot of personal statement ERAS application. I'm taking interviews, both IMG and American graduates over the last 7 years. So I am going to share all those tips and techniques with you in this video. So first we will focus on what are the changes in the ERAS application. If maybe you applied last year and this year there is some changes. I reviewed the application so that I can share all the important updates with you. So very important to remember that your experience is the key. This is your money here. This is the most important part of your application. The program director, the selection committee, they will call the candidates. A large number of the candidates will be selected based on their experience. So for this ERAS 2026, you will be asked to share 10 experiences. Among those 10, you have to tell what are the three most meaningful experiences. And I will share more tips how to write those. So if you open the ERAS 2026 worksheet, and I will highly recommend you to download that. If you go to ERAS website, you can download a draft worksheet. That will be helpful for you because you have to go through the whole application. So I have already reviewed it for you to make your life easy. So one change in this application for 2026 is that you can add education/training. In my view, this is a good thing. Maybe you have postgraduate training in India. Maybe you have the MRCP from UK, you work there. If you have any education/training, this is a great opportunity to highlight. Besides that, in these selected experiences, you will be able to add work, research, volunteer, professional organization, teaching/mentoring. Now let's focus on the selected experiences because I already told that this is the most important part of your ERAS application. Under the work, you can mention any kind of clinical experience if you have any teaching. For volunteer, it's straightforward if it is unpaid. If it is any extracurricular committee activity, you can mention it here. And finally, research, if it is paid, then I will advise you to put it as work. Now, for most of the cases, you may have externship. You may be an international medical graduate, IMG. Externship always have more weight because any residency program, regardless of their specialty, they love hands-on experience. It gives them the confidence that, okay, this candidate will be able to at least give the basic care to the patient from the first day. So if you have externship, I will highly advise you to put it in these selected experiences because program love it. It shows that you have credibility, you have experience hands-on. On the other hand, you may have observership, it is better than none, right? If you are a candidate that, okay, you have only observership, it is better than none. So definitely it does not have the same credibility weight as externship because that is hands-on. If you have observership, I will share with you how you can write so that it shows that, okay, you have that experience, at least you are familiar with the US health system, you know how the physician work here. Under the experience, description is vital. This is again your most important part under the experience. So which things you should write in the description box? What did you learn? Which skill did you develop? You can mention case presentation, electronic medical record, you are familiar. You have clinical knowledge through didactics, like you attended grand round, noon conference, journal club, time management, how you are prioritizing sick patient, teamwork, you know how to work with nurses, physical therapy, occupational therapy, social work. All these are very important. And overall, if you have any kind of experience of doing patient counseling, patient education, seeing a rare disease, knowing a physical exam technique, any kind of ultrasound technique, that you can also mention under the description for specific experiences. Couple of tips for the description is that do not keep it blank because again, this is the most important part of your application. You must not keep it blank. Keep it clear and concise. It need to be to the point. And finally, keep it bullet point, 3 to 5 points. Rather than description, it is far, far easier for your program director, for your interviewer, just to glance the bullet point. So if you are writing bullet point, keep it 3 to 5 points. So when you are writing the description, how you will write? I will highly recommend you to use active verbs because that gives power to your writing. For example, you mentioned I did, I saw, versus I performed, I conducted. Did you see when you are using active verb, it is showing that, okay, this person knows, this person has the power, has that credibility. It takes your writing at a whole different level. So here is the few example of active verbs. So when you are using active verbs, I will highly recommend you to use that. If you do not know, if English is second language like me, you can always Google that list of active verb and you will be surprised how many concise list you can find out from Google about the active verb. Now, the second part of selected experience, as I have already mentioned, among those 10, you have to talk about 3. Why this experience is meaningful. Do not just copy paste the same thing, what you mentioned in the description box. Remember, they're asking specifically why this experience is meaningful. So maybe, you still remember a patient encounter, you still remember how they were presenting the case. Whatever it is, make sure you are writing it. And remember, the character limit is 300. It's not word. It's 300 character limit for each of these 3 meaningful experiences. After the meaningful experience, there will be a box of impactful experiences. And if you scroll down, you will be able to see under the impactful experiences, they're asking about family background. Are you the first generation who went to college? If you are like me, who are first generation physician, you can also mention that. Financial background, are you from low income family? Are you from family who are working and you are supporting your family along with your medical school or along with your residency preparation? Are you from a neighborhood who has poverty, crime rate, food scarcity, limited educational opportunities? Or maybe, God forbid, this is a loss of family member. How did you overcome? And what that challenging experience taught you? How you are more empathic? How you are a better physician now than before that experience? Whatever is your challenge, this is a great opportunity to share with your program director. Remember, this is your option to not to make them cry, not to create a sobbing story. However, your goal is to show how those challenges, struggle, made you a better person, made you a great physician, gave you a couple of qualities that you will bring during your residency training. Do not tell that, okay, exam was hard, exam was long, medical school is difficult. Everybody went through medical school and it's just part of the medical school. They are asking anything specific about your experiences. I want to draw your attention here, the next option about academic versus professional interruptions or extension. Sometimes many of my students, both from US graduate or IMG, they ask me, okay, Dr. Hoque, my education got like prolonged for 2 months, 3 months. Should I include it? And if you go through that application, and my advice will be, if this is minor prolongation, you do not have to include it. However, if this is something serious, like professional misconduct, you got punished by your medical school for any kind of professional liability, then you have to mention it. Because remember, many medical residency program, they may screen out from the interruption or extension, because many programs they do not want to have candidate if there is an interruption. So if you do not have it but you are mentioning yes, you are putting your application at very high risk of getting screened out. So think twice, and if you have any question about that, you can put in the chat. I can also answer for you. Then you will be asked about honors and awards. Alpha Omega Alpha, Gold Humanitarianism. None of the IMG have it. If you are an American medical graduate, you may have it. That's fine. Go ahead. However, if you are an American graduate, you do not have it, or an IMG, none of the IMG have it. So do not worry about it. What about your medical school award? If you have any award from medical school, that's great. You should mention it. My advice will be you should give some context. For example, was it a national award? Was it a regional award? You got this award among how many students? Was it 100? Was it 25? Whatever it is context, you must have to give at least one line. Because if you are not explaining about your award, none of the program director, none of the interviewer will be able to know. Many students asked me this question that, okay, what should I do about my high school award, nursery award? If it is very, very old award, think twice before adding it. However, if this is like national award, when you are in high school, you got super prestigious national award, international award, then it is different. Otherwise, be conservative about using very old award like high school award rather than focus on your medical school award or other award which is like very recent, within I should say 5 to 10 years. Many students have this question about hobby. Hobby, you may think that, okay, who cares about hobby? I'm going to be physician, I will be busy anyway. Remember, hobby could be very common topic for your interview, because when I am the interviewer over the last 7 years, whenever I am reviewing the application, I always go through hobby because my goal is to make them comfortable, and I'm not alone. Many of the interviewer, they go through hobby, and so that they can start that question so that candidate is comfortable when they are starting the interview. So it could be a common topic. It signals that how you are as a person, which things you enjoy. And remember, the program is trying to find out how you are person as overall. They are not just focusing on how you are as a physician. That is important for sure. At the same time, every program wants to have a great human being who is like great team member, great physician, great clinical knowledge. So your hobbies give some clue that, okay, are you a team player? Do you know that, okay, you need to follow certain rules? For example, maybe you are in playing soccer, you have to play the rule, right? You have to work with team. So take advantage to share how you are as a person. Again, remember the character limit is 300, not 1. Signaling. I will recommend you highly that take this program signaling very, very seriously, because this is your opportunity to express interest in a residency program. So what you can do to give the right signal? First of all, research your program. Find out, are they taking candidates with similar scores like you, with similar year of graduation like you, with similar visa status, like are they taking green card? Are they doing J1, H1? So you understand what is the right program for you. Because remember, according to the program specialty, it is different. So research your program well so that you can give the signal to the program. Remember, many program directors, the research study has been shown that they use program signals to call for the interview. So if this is your target program, give them the signal. because nowadays many program screen out through the program signal. So if you want some program, give them the signal. Spelling, grammar, punctuation, it may sound very simple, but remember, if there is one spelling mistake or grammar mistake, it can just totally ruin your credibility. It can just, build such a bad reputation that program director or interviewer do not get any interest to proceed further. So take it seriously. Remember, the ERAS application does not have any spell check or grammar check, at least as of now. So it comes to you. Proofread, take feedback. You can use software to use grammar check, spell check, and also you don't use all caps. Sometimes people feel that, okay, if I use all caps, it shows importance. No, it is not grammatically right and it is not easy to read. Languages. This is important that your English language is very good, very good. If you are also mentioning that Spanish and going to some hospitals of Florida, that is also helpful if you have good Spanish, right? So when you are communicating, interacting in English with patient, with your colleague, your English must be good. So it should be native versus near native. Geographic preferences, you have to choose the geographic preferences. If you want to go to a particular place, maybe your family is there, maybe you just like the weather, maybe you are already living there, you love the environment, you have a lot of friends, and you just do not want to move. So choose your geographic preferences wisely. Email address. During this ERAS season, you will get so many emails. So my advice will be use a separate email address for your ERAS application. And many times you will see that, okay, people are using fancy name like a Spider-Man, Frozen. Use a professional email address and it could be your first name, last name. Simple. Keep things simple and professional and use separate email address. Photo. In the ERAS application, you have to give a picture. It need to be professional, because it creates fast impression. The candidate does not have to be model-like. The candidate need to look professional so that program believe that, okay, this person, the patients will trust on this physician. So having a professional outlook, having a professional hairstyle for female, minimum makeup, very minimum jewelry is very important. It requires planning, right? Because you were taking time, you were dressing up yourself, finding out time, getting a professional picture. It takes time, planning, but it's important. So do it. I will recommend you to add it in your CV when you are requesting for letter of recommendation. So this is my last slide. Remember, you cannot apply to programs until your application has been certified and submitted. You have to do that. At the same time, once you submit your application, you cannot make any changes except your address. That's it. So take advantage. Know which things you must follow for your ERAS application, because ERAS application is very, very important. It is your first step to get that interview, to shine among those maybe 5,000, 6,000 applicants. And if you want to know how to create the personal statement, how to obtain the letter of recommendation, there are a couple of videos I will be preparing soon. Thank you so much for joining me today. I wish you all the best. Please like this video, subscribe to this channel, and share this video with your friends who you believe that will be benefited from this educational video. And please subscribe, because your inspiration give me motivation to create more video. And truly, you do not want to miss more useful videos like these. Thank you so much for joining. Until then, take care. God bless you.